UTIs are very common and lead to more than 8 million office and ER visits each year. If you need to go to the ER, then I know you're in significant distress. Listen to this information to know how you should be treated properly. Welcome to Women's Healthcare Answers, and this is Jeff McQueary, a Tennessee gynecologist. I want to focus on you, especially if your gynecologic problems are dominating your life and you want to take back control. You can solve your problems with answers and solutions I will give you. So what is a UTI? It's an infection of any part of the urinary system, including the kidneys, ureters, bladder, and urethra. And even though we talk about UTIs, we mostly mean bladder and urethra infection. They are the most common sites of infection that are painful and annoying. So, please stay till the end for my key recommendations about how you should be treated, because it's not always done right. The most common bladder infection symptoms are burning when urinating, urethral pain, difficulty initiating a stream, a strong urge to urinate that continues after you've already emptied your bladder, as well as a strong smell to your urine can also happen. Your urine also can be cloudy or bloody and often associated with pain above your pubic bone. But why do we even treat UTIs except for these symptoms? Well, especially for older adults and people with poor immune systems, infections can move to the kidneys, where they can become very serious very quickly. Those symptoms include high fever, chills, back or pain in the side, which is called flank pain, and in the elderly, they may even have confusion and weakness. This infection can even enter the bloodstream, causing sepsis, which can become serious, life-threatening infection. So how does a UTI even happen? Well, bacteria enters the urethra and can spread all the way up the urinary system. We all have some bacteria in the bladder, but normally we clear them rapidly with sterile urine filling the bladder and then completely emptying when we pee. Other things can lead to bladder infections, such as increased frequency of sex, especially with a new sexual partner, kidney stone blockages, and catheter use increases the risk of bladder and urinary infections. But where does bacteria that causes these infections come from? Well, it may be obvious that local contamination is a cause. This is because the vagina and urethra is next to the rectum, so there is a ready source for bad bacteria. The different bacteria that infect include E. coli, which is the most common, about 80% of infections, but also Klebsiella, Proteus, and many other types of bacteria can cause UTIs as well. Well, it's great to know what causes the problem, but how do we prevent infections? Well, drink lots of water. This can be difficult when you have infection due to all the urgency and frequency you already have. But it's important to flush bacteria out of the urinary system. So when I was a medical student, I learned the saying, the solution to pollution is dilution. I always remembered that. In fact, I teach my own medical students, and maybe you can too. Just drink water and wash those bacteria away. But you can also use cranberry and D-mannose capsules, which typically is found in most stores as azo. And these remedies prevent bacteria from sticking to the bladder wall. Condoms with spermicides can sometimes cause bacterial overgrowth, so try to avoid spermicides if you tend to get UTIs. And try to empty your bladder soon after sex, so any bacteria that was pushed into your bladder can be released. Lastly, always wipe from front to back. I say that not to insult your intelligence. I think most people know this, but it's just for your information. So if you like this video so far, hit the like button. It really helps with YouTube. And please subscribe, because if you miss any of my new medical videos coming out every week, who am I going to talk to? Just give me a thumbs up and please comment. So back to the information you want. How do we typically treat bladder infections? Well, after urinalysis, often a culture will be performed, and should be if you have chronic infections. Based upon the urinalysis and culture, the best antibiotics will be chosen based upon your allergies. So the best antibiotics are sulfamethoxazole trimethoprim, which is a combination antibiotic known as Bactrim. Also nitrofurantoin, known as macrobid, fosfomycin, and cefazolin, which is known as Keflex. I would recommend if you get treated with the antibiotics, ask not to be treated with Cipro. This antibiotic has been overused and most common UTI bacteria are now very resistant to it. If you've had a lot of UTIs, you may also have recurrent bladder infections. The definition of this condition is 2 culture-proven bladder infections in 6 months or 3 in 1 year. And what tests are potentially done if you're diagnosed with recurrent UTIs? Well, we still do a urinalysis and culture, but we may try to see if you have retained urine, assessed after you pee by ultrasound or by an in and out catheter. I know that makes you real happy. But we may also consider looking in your bladder by cystoscopy, which is a bladder scope, or may even get a CAT scan, and this is done mostly if you have a lot of blood in your urine and it persists. Does the treatment differ between simple infections and recurrent infections? Well, antibiotics are typically given as discussed earlier, but we also take into consideration other things: the type of bacteria, the pattern of resistance to different antibiotics, the long-term costs, and the tolerability of the treatment. So prevention is the key to recurrent infections as well, though. So lots of fluids to wash the bladder, but also vaginal estrogen use if there is thinning of the vaginal tissues with menopause, because often there is abnormal bacterial overgrowth if you're not well estrogenized. We may also consider preventive antibiotics at night because your urine is just stewing at night. Antibiotic options include Bactrim single strength nightly, Macrodantin 50 milligrams nightly, or fosfomycin 3 grams every 10 days. Why 10 days? Because it stays in the blood 30 to 40 hours after 1 dose. So it becomes a good option that is intermittent. Also a non-antibiotic option is methenamine hippurate. This medication consists of salts that are converted in the urine into ammonia, which is acidic, and formaldehyde, which is bacteriostatic. Both effects help to prevent bacterial growth. Methenamine can be used short-term or even long-term in patients who cannot take antibiotics as well. In the future, we hope we may even have a vaccine that will help prevent UTIs, but we don't have that yet. So, what you've been waiting for, what are my key recommendations about UTIs? You must be accurately diagnosed with urinalysis and urine culture as well if you have recurrent UTIs. Also, prevention of UTIs is most important with water hydration, voiding right after sex, and vaginal estrogen therapy in menopause. If you are having recurrent UTIs, you should be referred to a urologist or urogynecologist, which is a gynecologist who specializes in bladder and pelvic prolapse issues, and that is what I do. Antibiotics should be given with nitrofurantoin as the first choice, and fosfomycin and Bactrim as the second line. Cipro should not be a first line of treatment for UTIs. Just remember that. Also, recurrent UTIs can be effectively prevented with low-dose antibiotic suppression or a non-antibiotic option such as methenamine. Hopefully you feel you learned something, and as always, I have enjoyed being here with you. I would love to help you solve your problems at Women's Healthcare Answers. Remember, this video is meant for information purposes only. Please consult your own healthcare provider, but it's okay to reference the information I gave you.